My name is Matthew. I'm an assistant psychologist and I work for the Isle of Man Government's Mental Health Services. I'm creating this video today as a resource for frontline staff who may be experiencing different forms of mental health following the coronavirus pandemic. The aim is to educate you about the different psychological responses to stress and how this can impact stress disorders, anxiety, and other mood problems. And following the identification of those problems, I aim to give you some practical skills and coping mechanisms in order to be able to cope with them and perform more effectively at work. Now, stress is our body's automatic response to a challenging event or situation or thought about an event that we might experience every so often. During the times of coronavirus, stress may be experienced more often in frontline workers, and prolonged exposure to stress may have different effects on different forms of mental health. And firstly, I'd like to start with post-traumatic stress disorder. Post-traumatic stress disorder is a stress-related disorder that may be developed in an individual who is exposed to death, threatened death, actual or threatened serious physical harm. Frontline workers may be more at risk of developing post-traumatic stress disorder as they have an influx in patients that are diagnosed with coronavirus. Now, what you may notice is several different symptoms, such as intrusions like intrusive memories, thoughts, images, flashbacks, and nightmares about the event itself. You may also notice avoidance symptoms, such as not wanting to go to the place where it happened, or avoiding people, things, or conversations that reminded you of the stressful experience. You could also notice changes in your mood, such as heightened anxiety, depression, and low mood, as well as anger. Another common reaction to post-traumatic stress is hyperarousal. Now, what that means is a person tends to be on high alert all the time following a traumatic experience because they've just witnessed a life-threatening event. Their bodies and minds become hyper-vigilant to anything in the immediate environment that could cause danger. So you may notice a prolonged stress response. This is a natural and normal response as our bodies are designed and our minds are designed to protect us from danger. So we may feel this when we don't want to. However, I can assure you that's a very normal response. This will subside naturally. It takes a couple of weeks to subside following exposure to an event. And this is what's known as watchful waiting. So monitoring your symptoms to see if the stress levels reduce over time, as naturally they will do. Moral injury is known as the psychological distress that's experienced following actions that contradict our internal ethical and moral beliefs. As staff on the front line are constantly faced with time pressures, staffing pressures, resource and equipment pressures, they may find that they commit acts that violate their internal moral codes, such as not being able to give patient enough time. And it's these violations of our moral codes that have a strong relationship with different mental health problems, such as post-traumatic stress disorder, as discussed, and also anxiety and low mood. Now, anxiety and stress are quite similar in terms of how they make our body feel. However, anxiety is much more of a prolonged, sustained mental health condition. Generalized anxiety disorder is where people find themselves worrying excessively about lots of different things, usually focused on elements of danger or threat, or the worst possible outcome. Now, worrying and anxiety are related in a sense. If you worry a lot, you might predict negative outcomes, and that can produce an anxiety response. So when we worry, not only does it affect our thoughts about situations, but it affects how our body feels. We quite often notice our heartbeat increase, breathing changes, stomach changes, we might be more jittery, and that also impacts our behaviors, which means we might avoid certain things like social situations or work environments that make us feel anxious. So generalized anxiety really is that chronic excessive worry that you notice as well in your side of your body and also in your behavior through different types of avoidance. And this might be more common in frontline staff at the moment as they're putting themselves at increased risk every day, which naturally comes with more worry and more anxiety. Panic is when your body experiences a rush of intense mental and physical sensations that are associated with the classic anxiety and fear response, commonly known as fight or flight. Panic attacks often last between 5 and 20 minutes. Panic attacks are not dangerous and they are not harmful to us, despite the fact they feel that way. That's because our bodies are experiencing a surge in adrenaline and it's hard for us to make sense of what's happening. Therefore, we go into a panic state and believe we need medical assistance. However, panic attacks are not dangerous and they will not cause you any harm. Obsessive compulsive disorder is another type of anxiety disorder commonly known as OCD. Now this comes with obsessions, which are commonly known as intrusive thoughts, which are accompanied with compulsive behaviors. So the obsessions are repeated thoughts, urges, or mental images that cause anxiety, usually related to fear of germs, contamination, or getting sick, which lead to unhelpful behaviors known as compulsions, which are repetitive in response to those thoughts. So to try and protect ourselves from whatever it is we're thinking about, e.g. becoming infected. So you might find yourself having lots of intrusive thoughts and carrying out lots of behaviors to try and counteract those thoughts, which actually may increase or maintain the anxiety you're experiencing. Frontline staff are also at risk of developing low mood and depression following the repeated stresses they find themselves under and moral injuries as discussed before. Now, depression is a severe mental illness whereby people might have extreme negative thoughts relating to their worth, how helpless they are, and how hopeless things are. And this comes with a lot of automatic negative thoughts that tend to reflect a poor view of the self and the world. And this could also fall into patterns of losing interest in activities you used to enjoy and not really feeling much point in doing anything and becoming quite withdrawn and socially inept and not engaging with friends and family. Depression might affect your productivity at work. You may notice that you're not performing your best and you may fall into unhelpful thinking patterns about yourself and about how you're performing at work. This is why it's essential to pay attention to how you feel and notice when you feel low or you're being more negative towards yourself than you might usually be. Now I've outlined the different types of psychological responses and mental health problems that people might experience working on the front line, you may be thinking, how do I cope with them? What do I do? Firstly, have a look at the booklet that's been provided for you, the mental health advice of frontline workers. There's lots of practical skills and techniques to use in that booklet that you can access immediately right now in this very moment. So please go and check it out. A lot of different psychological problems come with automatic negative thoughts. And automatic negative thoughts are a natural part of mental health. Negative thoughts reflect the way we feel. If it's anxiety, our thoughts may be more reflective of danger. If it's depression, our thoughts may be more reflective of our worth. It's important that we understand that when we're distressed psychologically, these thoughts will be distorted. They're not very accurate. Therefore, there's different thought management techniques you can use in order to help you. That might be recording your thoughts down in a diary, challenging your thoughts in various ways, and being able to think a little bit more flexibly. And for more resources on this and practical techniques, please go to the booklet provided. Self-care tips that will help with different psychological problems are maintaining your body's natural rhythm in terms of eating regularly, drinking regularly and staying hydrated, and trying to maintain a regular sleeping pattern, all have major psychological benefits. I know you're all aware of these things, but I just want to reinforce them for you. Also talking to your friends, colleagues, maintaining communication with people as much as you can, as hard as it might be. Talking to people provides a great sense of relief, and also with colleagues, it gives you that ability to have almost like a peer supervision and discuss things with each other, as well as your management, about anything you might be struggling with. And remember, you are important, so take care of yourself. Self-compassion is the ability to respond to yourself effectively in times of distress and discomfort. It's the way in which you talk to your patients, your family members, your friends. When they're experiencing difficulties, would you tell them they're not good enough? Would you tell them that they failed? You wouldn't. You would encourage them, give them support, a kind word, remind them of their successes, tell them how well they're doing. Every single individual putting themselves on the front line is doing a fantastic job. And for more helpful tips on how to develop an inner compassionate self, check the resource booklet that's provided. And don't forget, you're doing an absolutely amazing job. And thank you very much for all the hard work you're doing. Our island is in this together. Thank you.